Welcome to our next video in the series on ACL rehabilitation, following an athlete from surgery all the way back onto the field. We're now in week 10 of Maddie's post-op progression. This is the first part of phase 3 of this protocol, and we want to get comfortable with running and sprinting, demonstrate good control with pivoting, cutting, and jumping, and master some of the functional activities related to soccer. We need to make sure there's no swelling, good knee control, no joint line tenderness around the surgery site, and no pain with McMurray's test. Now, typically when someone starts their walk-jog progression, we'll have them walk for 30 seconds and then jog for a minute. And the reason for this is to give them time for recovery, not only for their muscles, but also to make sure that they get a break from the impact that's associated with jogging, which is new to them and typically can cause some soreness or irritation. As far as the running is concerned, we want to make sure they have symmetrical step length, good toe off, good knee position, good trunk rotation, and that when they land, they're not landing heavy on the surgical side. We'll also have them start on some backpedaling activities like you see here. We use the resistance cord so that they can do short, quick steps on the way back using the glutes and hamstrings, and then eccentrically have to control the knee using the quads as the band pulls them forward. Now looking at the agility ladder, you can see that Maddie's progressed in both the speed and fluidity of her movement. You can look at her feet that she has nice symmetrical step length, symmetrical weight bearing, and is going at an increased pace from what's seen before. When we pan back, you want to take a look and make sure that her body movements are symmetrical, that she's using her arms and upper body. We'll typically remind them that the arms drive the legs, as a lot of times the athletes will be so focused on looking at their toes and seeing how quickly they move their steps that they forget to use their arm drive, which is very important in both running and agility activities. From a lateral perspective, again, you want to look for symmetrical motion. In Maddie's case, she's done these before and we know she's familiar with them. We also want to look for good knee height and good knee control as she goes through these motions. With the shuffling activity, which brings in a component of cutting, you want to make sure that she's got, again, symmetrical movement, that her arms are driving the legs as we talked about earlier, and that she feels comfortable with this transition of multi-plane movement. Looking at her squatting mechanics, she still favors the left side a little bit as she goes down. And we go to the single leg squat. You'll see that when she moves to the surgical side on the left, her first squat is a little hesitant and not as well controlled as her subsequent squats are. This is evidence of some motor learning that has progressed, and we want to continue to work on this as we go through. As far as functional activities, we want to progress her volleys. We'll continue with the single leg volleys similar to what we did before. We'll just step back further so that she has to hit the ball a little harder. We'll also progress this so that we have to do some thigh trap and a volley using both the same side for the volley as well as volleying with the opposite side. Now at the end of this session, we reassessed Maddie and we found she did have a little bit of joint soreness, a little bit of medial joint tenderness around the surgical site. So we shut her down for the remainder of the week and treated her so that she'd be able to recover. Hopefully when she comes back next week, we'll be able to reassess her, see if we can resume some impact activities and progress her functional activities per protocol. Please post your questions on the forum. Thank you.